Hello friends, welcome back to VGS Clinics. In this clinical class, I will discuss how to palpate axillary lymph nodes. It is essential to acquire this clinical skill as we frequently require to palpate these lymph nodes. You may recall what I said at the outset in the video on local examination. Local examination is never complete without examination of the surrounding area and regional lymph nodes. The axilla is a pyramidal space between the arm and the side of the thorax, with its lower limit leveling with the fourth rib. It is bounded in front and behind by axillary folds. This hollow space called axilla exists when the arm is lying by the side of the thorax. The shape and size of the axilla varies depending on the position of the arm. The axilla virtually does not exist when the arm is fully abducted. Then the axillary folds disappear and the hollow is replaced by a bulge. The apex of the axilla is bounded by clavicle, scapula, and the outer border of the first rib. Apex is the channel of communication between axilla and posterior triangle of the neck. Floor is the axillary fascia extending from the fascia over the serratus anterior medially to the deep fascia of the arm laterally. The axillary fascia is attached in front and behind to the margins of the axillary folds and is suspended by the suspensory ligament from the lower border of pectoralis minor. The anterior wall is formed by pectoralis major, pectoralis minor, subclavius, and the clavipectoral fascia. The posterior wall is formed by subscapularis and teres major, with the tendon of latissimus dorsi winding around teres major. The medial wall is formed by the upper part of serratus anterior. As far as the lateral wall is concerned, well, even if it is mentioned, practically there is hardly any lateral wall as such, because the anterior and posterior walls converge laterally onto the lips of intertubercular groove of the humerus, which is a very narrow structure to be qualified as a wall. Axilla contains neurovascular bundle and several lymph nodes embedded in fibrofatty areolar tissue. They are usually described as lying in 5 groups. Each group contains around 5 to 7 nodes, sometimes more. Now I will describe these groups in the same sequence in which they are palpated clinically. The central group contains nodes located roughly in the center of the axilla. The apical group is located in the apex of the axilla. It receives lymph from all the remaining groups. These nodes in turn drain into supraclavicular nodes lying in the lower part of the posterior triangle of neck. The anterior, also called pectoral group, lies along the medial wall of the axilla at the lower border of pectoralis minor. Nodes in this group receive lymph from the upper half of the trunk anteriorly and from major part of the breast, especially superolateral quadrant and subareolar plexus. The lateral group lies along the so-called lateral wall of axilla. These nodes receive nearly all the lymph from the upper limb. The posterior, also called subscapular group, lies along the medial wall of the axilla in the posterior part. These nodes receive lymph from upper half of the trunk posteriorly and from the axillary tail of the breast. Now let us see how to palpate these nodes. Initially, sit or stand facing the patient. I will demonstrate palpation of the left axilla and explain the positions of the limbs of both the clinician and the patient for the same. While palpating the right axilla, reverse those positions like this. These are the initial positions of the limbs for palpating the left axilla, and these are the ones for the right axilla. As far as the technique of palpation is concerned, palpate with gentle rolling movements of the pulp of fingertips. Here I am demonstrating palpation of the left axilla. Keep your left hand on the patient's shoulder. Ask the patient to rest his hand onto your left forearm and to relax. That is, allow his elbow to hang freely with the gravity. Begin palpation by inserting your right hand fingers in the axilla to first feel the central group of nodes. Then insinuate your fingers further up gently, simultaneously pushing the patient's shoulder down and feel the apical nodes. Then feel the anterior group of nodes with the fingers on the inner side and the thumb on the outer side of the anterior axillary fold. After this, take your left hand off the patient's shoulder and palpate the lateral group of nodes with your left hand fingers. Then go around, stand behind the patient and palpate the posterior group of nodes with fingers on the inner side and the thumb on the outer side of the posterior axillary fold. Thanks for watching.